So one of the other things that we're starting to find too is there's a PT over in the UK that's doing he's getting his PhD in Paul Hansborough, and he's looking at performance in athletes and utilizing the shockwave. And
Hmm.
so he presented in Boston again at that conference. On some of his early findings is what 8%, or excuse me, there 50% of the athletes that were testing quad strength on had an 8% improvement in strength 3 days after application,
Wow.
which
That's pretty wild.
that's massive.
Welcome to the Beyond Physio podcast, where we help you move, excel, and inspire others on your journey to your next level with knowledge and advice from experts and testimonials from our like-minded community. On our show today, I have my good friend, Keith Rode, who is a doctor of physical therapy, owner of Impact Physical Therapy and Wellness out in South Dakota. Keith, welcome to our show.
Thanks, Jerry. Nice to be here. And I will correct you slightly.
Yes.
I live in South Dakota, but the clinics are actually in Iowa, so it's just across the
Ah,
border. It's so close,
so
but we're
close.
we're we're, we're kind of South Dakota, but it's Iowa.
Cool. Now let's talk about that, Keith. So
Yeah.
not when people think about SDSU, they often think about San Diego State University, but you went
Yes.
to the other SDSU. Can you talk about
I
that?
w- I went to the real SDSU,
Is that
the
what
the
it is?
the, the proper SDS,
The proper
you know,
SDSU.
the South Dakota State University. And I think
Hmm.
that the state university should be able to, they should have that insignia of the SDSU. And then no offense to San Diego State, but I think that they should go by San Diego State and not SDSU anymore. I think it's only
Uh-huh.
proper that the actual state gets the acronym for that, instead of us having to be SD State on everything. It should be
Ah,
SDSU. That's South Dakota State, and so San Diego should have to move. I think it's smaller than a whole state, right? So that makes sense.
yeah, I definitely sense some friction there. But the reason why I want to bring up the real SDSU is this is where you took a class, a guided imagery activity, I think it was. And this
Mhm.
actually paved the path for you to get onto the road for physical therapy. Is that right?
Yeah, that's correct. I didn't get into this career because of uh, athletic injuries and things of that nature that I had myself. I was an RA up at South Dakota State, and we had to take
Mm,
these different RA classes. And one of them was this guided imagery activity. And I remember it very vividly. And so it was kind of like a meditation exercise. I remember we were kind of just sitting on the floor. We had our eyes closed, and there was basically a general moderator or somebody that was narrating a general, this is what's happening. And then you paint the canvas in your brain as far
mm,
as what you think is what's going on in your life. And I remember she's like, it's 10 years down the road. What are you doing? Kind of a thing. And I remember it was like 6:30 in the morning or something like that. And I was waking up in this house. I was in this kitchen making breakfast. And I'm like, what am I doing up at 6:30 in the morning as a 20-year-old college student?
unheard of.
Yeah, unheard of. I was like, I can't sleep in until 8, 9, 10 o'clock. What's going on? Um, Apparently my brain was telling me that you're going to have responsibilities in the future.
Yeah.
You should get it.
Oh, man.
And then the next thing I remember, I was driving home, or not driving home, but driving to work somewhere in the car. I didn't know where I was going. And so it was just kind of this journey that was just, going and going and going. And I didn't know where this path was leading me. And it was very vivid, like like the soap opera, and it has like little clouds around the borders of the TV
Yeah.
screen. It's like, where's like a dream or something like that.
Yeah.
That's kind of what it seemed like. And I remember we were walking down this white hallway. So I arrived at my place where I was working. I didn't know what I was doing or where I was at really, but I was this white hallway I was walking down. And then the next thing I remember is that I was helping some lady learn how to walk again in the parallel bars.
That's
And I
wild,
went,
man.
and it hit me. I'm like, oh, wow. I said, okay, I'm listening to you. And so to me, that was like a vision,
Yeah.
or, it was like God's way of telling me, hey, this is what your purpose is. And this is what you're put on this earth to do. And so it wasn't the fact that I've had rehab or therapy for my own athletic injuries or issues.
Mhm.
It was really about that vision or that piece that struck me. And I'm like, whoa, it hit me in my core. I'm like, he's telling me something, and I need to kind of focus and go forward with this.
I love that story, Keith. I actually did not know that about you. And what's really
Yeah.
powerful about that is not only have you had the impact on your patients, of course, on your staff, on your family, you've also
Hmm.
had an impact on my life as a good friend and also a fellow entrepreneur in the healthcare space. So I can see how that vision has really come to manifest and come into fruition to where you're doing some powerful things in the lives of everybody around you.
Yeah. Yeah. It's been absolutely transformational. And I think that really sets the bedrock and the foundation for what we're about,
Yeah.
at Impact Physical Therapy is really about just helping people, honestly. I think you ask any healthcare provider and the number one thing or the reason why they got into it in the first place, oftentimes is because I want to help people. But I think somewhere along the way, a lot of people kind of get lost or
Mm,
they kind of forget that initial, burning desire, that urge. And whether that's, just they as people grow, they change a little bit, or if it's because they get rooted in a culture
mm.
or they get overworked, overstressed, and it becomes something and that's not fun for them anymore. And so then they lose that passion and that desire. And so that's something that's very near and dear to my heart and very important. And I protect it uh, quite extensively at the clinic to make sure that we are giving our all to the people that are coming into our door. These people are trusting us with their care. There's a reason why they're here. They're in pain. They're nervous. They're scared. They're afraid. We're here to do the right thing. And even if that means it's something that, unfortunately, we can't fix every single thing, but if we can't help them, or we can only get them so far, the proper and important thing is that we at least we have a helping hand to help guide them to the next phase. It's just not like a cutoff. It's hey, let's go this route, or there's some sort of a handoff there, so that way the patient doesn't just feel like they're out in limbo, like I don't know what to do.
Yeah.
And I think to me it just comes down to doing the right thing. Do what's good for the person. Do what's right for them. Just take care of people.
Yeah. That really mirrors our approach to at next level where, and I think you really touched on it, where we're not only trying to help people physically, but we're really trying to
Mhm.
provide a whole person approach to make sure
Yeah,
that we can, because there are other areas of their lives that we can actually still impact, which is,
yeah,
whether it's getting to the right mindset, whether it's looking positively about what they have and what they're suffering from. So they do have that hope towards a better future because they are working with our teams and like with your
mhm,
teams as well. So very powerful. So I wanted to now dive into one way that you and I have both been helping patients, which is using regenerative technology. In this case, we're going to
yeah,
talk about Shockwave. So I wanted to
yeah,
deep dive into that today on today's episode because at Next Level, we are doing a relaunch of this modality, which we've been using for several years. Um,
mm,
and we've had now talking to you some very updated protocols and other
yep,
ways that we can use it even more effectively. So I want to dive into that today, Keith.
yeah. Absolutely. No, I mean, shockwave therapy is absolutely fantastic. I love it. If I could dive into my origin story with that a little bit,
Yeah.
I had never even heard of it up till about 2.5 years ago or so. I was in the clinic and I had a patient or an individual come in, wasn't a patient yet or anything, but they'd come in for a consultation for a chronic patellar tendonitis. And they drove from like, I don't know, 45, 60 minutes away just to come see me. So they came from another rural community
Wow.
a long ways away to my Akron clinic. So I got, the clinic in Sioux City. And then I got another clinic about a half an hour north of that in the small town of Akron, about 2,000 people. Sioux City's a little bit bigger, about 70, 80,000 people in that area, but Akron's like 2,000. So I had this another individual from a small town about an hour away come to see me in Akron. And they had they've gone through therapy. They had the 10X procedure done
Mm,
on the patellar tendon, and they did rehab afterwards, and it really wasn't any better. It
mm,
was still giving this kid a lot of problems, and now he was developing symptoms in his other knee, same stuff. We were kind of approaching like the state playoff time. He was a senior. He didn't want to miss any time, but he was taking 12 ibuprofen,
whoa.
12 ibuprofen in one setting
Wow.
just to get on the field so he could run.
S-
Otherwise, he couldn't even tolerate it. I'm like,
Wow.
it's like you're just overdosing.
Big time.
It was a huge concern. And so obviously I notified and expressed my concerns to his mother and everything about this. But one of the things that they had on there is there's this little a postcard of, questions to ask and whatnot. And one of them had ESWT on it. I'm
Mm,
like, huh, well, what's this? He goes, I don't know. My mom just asked me to ask you about it. I'm like,
mm.
okay. And so right on the spot, I do a quick Google search and then it's like shockwave therapy. I'm like, oh, this is interesting.
Yeah,
And so, I started reading more and more about that and just kind of researching the indications for it. And so I got more interested in it and I just more ingrained it. And so I did about 3 months of deep digging on the research with it. And so when I look at things, I would like to really educate myself
yeah,
to make sure I know everything in and out. And the big thing with this is like, holy smokes, this is potentially another possible way that we could help our patients even better than what we currently are serving them.
for sure.
Looking at it from the standpoint of, um, when I treat somebody, obviously, like we talked about, we're not always 100% effective.
Mhm.
Nothing ever is. But those people that I'm not able to get where I want them to get to, personally, for me, I log that in the back of my head. That's just the way how I'm wired.
Yeah, same way.
And it sounds kind of morbid to say this, but it's almost like a graveyard, and it's like of people that you
Mhm.
you weren't able to be successful with, or
Yeah,
that you feel like you failed, right? And so it's like you kind of take it personally to a degree. You
mhm,
try to separate it as much as you can.
sure.
But so I'm like, is this another chance or an opportunity that we could have maybe prevented or helped this person out so that they wouldn't have to go on to this next step to have these surgeries, or they have these issues, or they continue to live with this chronic condition that really there wasn't a surgical option for them. And they were just going to have to live in this chronic pain state for the rest of their life.
Yeah,
Is there a better way? And so shockwave therapy, after doing a lot of research and reading on it, that seemed to be a pathway. And it was something that's not super well known. Now, obviously, it's been growing more and more the last couple of years. I would say the last 2 years, it's really grown as far as popularity. But like I had never heard of it. And I actually did a presentation yesterday to the Briarcliff University class, the DPT class there. Those guys are getting ready to go out into their third year onto their internships and stuff like that. And I mean, they've never heard of this stuff either.
crazy.
So it's like, it's still, while it's getting more traction, becoming more popular, it's still not really, really well known.
Yeah,
And a lot of physicians, I think, especially the general docs, don't know a whole lot about it either. But you're seeing more orthopedics incorporating this technology into their clinics. Podiatry, it's a really huge hit with because a lot of the research really is the bulk of the research is really in plantar fasciitis, Achilles tendon,
right.
Achilles. I mean, it's absolutely fantastic. The results you get 85 to 90, 85 to 89% effective, so it's really, really good for that kind of stuff. But that's where the origin was. Like, hey, this is another way we could potentially help save some of these people from having to deal with this issue. Can we help more people with this?
Yeah,
And so that's how I got started with it. And then, obviously talking with you, you had it in your clinic, and I'm like, wow, okay, cool. And
right.
so, and I just really, I leaned on you a little bit when we first
Oh
got it.
yeah,
I had a couple phone calls like, hey, Jerry, we're just getting this in here. How are, and asking you all this kind of stuff. But, since then I've just continued just
oh
to
yeah,
dig and dive deeper into it. And I'm just a huge shockwave enthusiast
yeah,
now. Like I just love it because there's just so many things you can do with it, from a treatment application standpoint, whether you're treating acute injuries. So anybody that could be just, oh, I got this back pain that came up, or the shoulder pain, or specifically if you got an athlete who is having more soreness, or maybe they injured themselves. If you want to try to minimize downtime in the
yeah,
season and get them back to action, return to sport as quickly as possible, or from a recovery standpoint, to mitigate any kind of downtime that could come on. If they're a baseball pitcher, baseball's in season right now. So if somebody's having a sore shoulder or a sore elbow or something like that, like, get in and get a shockwave treatment, because your recovery time is going to be so much faster. And the likelihood of you developing a tendonitis or some other muscle issue after that is quite significantly reduced. So you miss less time, you're on stay in the field. It's a good thing.
yeah,
So acute injuries, athletic stuff, but chronic stuff, super powerful with chronic issues. You're talking about degenerative tissues, things that aren't getting the nutrition they need to be able to naturally heal. So when we think about the healing process, when we get injured, if we strain a muscle, or if let's say we have a bruise or something, there's an acute injury phase, a subacute, and then there's a maturation proliferation
Hmm.
phase, right? Naturally, that should happen. And what happens sometimes is these people that have like this chronic just ache or pain, it's because for some reason the body hasn't been able to heal that
Hmm.
area the way it normally should. Right. And so what shockwave therapy does is it really allows us to get deep down in there, attack things at the cell level, to stimulate that regenerative
Hmm.
process.
I love how you went into that. And so, one thing that some patients have asked prior to using Shockwave is, well, is this really safe? Will I get hurt because it sounds dangerous? But that's not the case, right, Keith?
Yeah. So I mean, the term shockwave can seem a little bit
Mhm.
scary. Um, I don't know if there's a different way we could brand it
That's
or they could
right.
brand that, but it always like, and a lot of times it gets confused with like electric
Yes, it
stimulation.
does.
Like, oh, well, I've had it before. I'm like,
No, you
no, you
haven't.
haven't. I guarantee you haven't. Like we were the first clinic in this
Mhm.
area that brought this into the whole
Yeah,
region. I'm like, I know you haven't had shockwave
it's
therapy. It's not
hilarious.
electricity. It's nothing like
Yeah,
that. That's an acoustic pressure
yeah.
wave, right? Or true radio acoustic pressure wave, I should say. But um, to your point, yeah, it does sound a little bit scary, but it's not at all, and it's actually quite comfortable. It can be quite comfortable. It does not have to be painful. We experience shockwaves every day in our life.
Oh,
All the sounds and reverberations that you hear are basically a product of shockwaves. When you think of aircrafts, fighter jets, when they go on off and they're producing shock waves, it's energy. If an explosion goes off, you feel the energy blast. That's a shock wave. Anything that you're hearing is essentially a sound wave of some sort. Even as I'm talking to you now, there is a sound wave or shock wave that's being emitted. In this case, it's being transmitted via audio, right? So, but it's not intense, right? So it's not like a boom,
right.
ouchie shockwave, but yeah, it does sound a little bit scary, but when we actually apply it, it should be quite
That's
comfortable.
great. So you and I both see quite a bit of active people and athletes. Would you say that there are any specific kinds of either protocols or programs that might be effective for somebody like a runner versus triathlete, or maybe even a youth athlete, depending on what they're coming in for? Would the settings vary depending on what they are coming in with?
Yeah, it really does. I think it depends on what you're going after. So I'm going to go through a couple different
Yeah.
examples if I can. So if you got somebody who is like a triathlete and you're training, this is an absolutely fantastic modality to keep you up to snuff and to anything from like a preventative standpoint to make sure your body is continuing to be optimal. It's healing, it's recovering, it's all those things. So it's an absolute fantastic thing to do in season or while you're
Mm,
training. It's going to minimize any soreness you have
that's cool.
afterwards. So that means you're going to be able to actually train more, or have less downtime with your training.
Hmm.
So it's going to enhance your performance
Yeah.
from that standpoint of things. The same thing from an athletic, triathlete or athletes, but like even if you're in a sport athlete, same kind of thing. It's a great thing from a preventative
Mm,
standpoint to kind of get in there once a week. Or we've even had some people, if we've done it like on the beginning of the week and then they have a game, a pretty stressful game, that's pretty sore afterwards, have them come in and get a second time. We want to give a window of a few days between the applications just to allow our body to heal and respond. Typical recommendation is one time a week for
mm,
Shockwave, but I have increased it with some of those athletes before. We've increased the
yeah.
frequency of the dosage and application, and we've had really good results
Now,
with it.
Keith, I know that you're also involved in a lot of youth sports too. And my
Mhm.
question was, and actually a question the parent asked me before was, well, is it safe on kids, especially with the growth plates in consideration?
Yeah,
Mhm.
absolutely. There's really no side effect outside of, you might have some
Mhm.
soreness, and like you would typically have after an intense bout of exercise. So, yeah, if there's going to be any side effect at all, it might be more sore for 2 to 3 days afterward. But otherwise, there's really no risk. There's no side
Yeah.
effect, and that's the beautiful thing about it. There's no scarring. There's no anesthesia. There's no like procedure that you have to really do. There's no downtime with it. There's all that kind of stuff, right? You can have it done and you can get out there. You can also even do it day of
Mm.
competition if you really wanted to.
Wow.
Which would, if you're a little bit sore, a little gipped
Mm.
up, that's actually going to improve your
Oh, that's
performance
an interesting
from an
point.
athletic standpoint. But versus applying it to kids, growth plates, what we're talking about with radio pressure. shockwave or acoustic shockwave, right? Um, it doesn't affect the
Mm,
bone. It really doesn't. It's not high enough
yeah.
energy to be able to penetrate into the bone to have a true effect on that. If you were going to affect the bone, you would need focused
Mm,
shockwave, which is a different type of shockwave. And we won't talk about that today, but that's what you would need. But even in that circumstance, I don't think you're going to have a negative effect. It's only going to be
mm-mm,
positive. It's only going to help the proliferation of growth factor, stem cell migration, and mitochondrial stimulation, all those types of things to get osteoblastic activity to help heal. And they've been proven to show that like focus shockwave, EMTT has been shown to help with the acceleration of healing of
yeah.
fractures, and things of that nature
That's pretty
too.
wild. One of the things that
Yeah.
I learned several years ago, which may not be true today, is that you actually shouldn't be using this near joint replacement prostheses. Or, for example, if you had a knee replacement, you shouldn't use shockwave near the site of that surgery. But it sounds to me like things have changed, and actually, it is pretty safe to use around the tissue. In fact, it actually helps to reduce some of that swelling around that tissue, right?
Yeah, yeah, it does. And so, this is where some of the protocols have changed a little bit, especially how we develop or apply them in our clinic is, after a total joint replacement, it's quite
Oh
invasive
yeah,
procedure. And oftentimes there's a lot of swelling and inflammation. So there could be a lot of time spent, you know, getting that leg elevated and trying to milking that fluid out the first couple of treatments until we can get some of that out of there so we can start working on more mobility. Otherwise, you're kind of climbing an uphill
yeah,
battle. You're climbing up a steep mountain
massive.
if you're going to try to improve range of motion and their knee
Yeah,
is this big, right? So you try to get that thing to shrink down so that way the joint has room to move and everything
yeah.
like that. So, and that's where this is coming really handy, is because it does open the lymphatic system
Mm,
up. It opens up those channels. There's so many things that we do with this and I think the research is continuing to evolve, and there's so many applications that we're not even quite sure everything that this is really doing
mm,
yet. I think, but you hit multiple points in one
mhm,
spot as you're doing this. I'm trying to find. I got a slide here somewhere that I presented
mhm.
yesterday, just to get everything right. But I mean, you think about what you're doing from a stimulation
Yeah,
standpoint. I mean, you're hitting the nervous system, you're hitting the circulatory system, you're hitting the musculoskeletal system
yeah.
clearly, the lymphatic system, the immune
Mhm.
system. So all those processes that you're stimulating while you're doing this, you're not just putting, just going putting
Yeah,
sound waves into the tissue just for the
yeah.
heck of it, right? It is hitting things at a cellular level. And, when we're stimulating that, so there's a lot of effects with, especially like a total knee to get that lymphatic system open up to be able to push that lymph flow out. And actually, I just had an ACL
Huh.
reconstruction we've been working on, and this person is really on their feet
Yeah.
a lot and probably more than what they should be. And I had a good discussion with him the other day about taking,
Compliance.
not being under, yeah, compliance because of it's just really thick, moderate pitting
Oh,
edema. Like you
wow.
stick it in there, it is really hard and thick. And so, we had a really hard time getting some of this fun about utilizing Shockwave though. It was
Oh,
so much
wow.
easier. And I was able to kind of get that in there and I'm using my applicator chip and I can kind of push it, um, and use those energy beams to kind of push into the tissue and kind of just push it out almost like if you ever swept your garage and then you sprayed it down
Yeah.
with water and you're using that, the
Yes.
squeegee to push the water away. That's kind of
Oh,
what you're doing.
yeah.
You can kind of utilize it that way to kind of help push that fluid and inflammation out of there. So that's what we do with our total joints too. We can kind of shape where that fluid's going with it. It's absolutely fantastic for the
Mm,
scar. Total joint, obviously, we got a big incision on the
yeah.
front of the knee. And, once that thing is fully closed and healed, what we could do is help with any prevention of scar tissue adhesions that could be lying underneath. Because we see this all the time, but what people don't always understand is that this is happening
Mhm.
underneath, and then that can get tethered down and stick into the knee joint and restrict movement. But if we can kind of break that up and make sure that that's not happening, so then the skin can glide, now we're going to have less problems with range of motion and getting the function back for that individual with
Definitely.
that knee
And guiding that
replacement.
process too. Yeah.
So yeah, so there's that. You're helping healing the process. You're actually going to guide the soft tissues to heal faster after the surgery. But like I said, the stimulation into the nervous system. So if they're having quad atrophy or quad firing problems,
Mhm.
it's going to wake the quad up. All right. So you're getting a lot of benefit here. We're talking about when we're strengthening things, And, when we go, I'm going to dip into like blood flow
Yeah.
restriction therapy a little bit. Um, you know, we talk about how we improve strength via blood flow
Yeah.
restriction therapy. It's because of muscle hypertrophy, because there's growth
Hmm.
factor migration via
Yeah.
hypoxia, right? Okay. So what are we doing with shockwave? We are stimulating the tissue. We're engorging it with
Hmm.
blood flow. We're opening up the vascular system, all these things. We have all these growth factors migrating to the muscle now. And we got all this mechanical stimulation to wake the
Hmm.
muscle up. Like, it's a fantastic recipe to try to really build and enhance
That's
some
awesome.
strength
And
there.
I'm so glad you touched on the blood flow restriction therapy. We're big believers in that. We have been using it for several years now, and it's been amazing for post-operative results, especially um, ACL is like the biggest one we use it for. But really, in terms of reducing the likelihood of breakdown of the muscle and atrophy, and also getting that person to
Yep.
get back to where they want to quicker, BFR is amazing. I feel like that in conjunction with Shockwave and some of these other regenerative technologies have been a real game changer for even our practice. It sounds like it's been for yours as well.
Yeah. So I utilize it a lot. So even if it's like something where they're not having a lot of pain yet and there's a weakness and we want to try to get some strength there, I will do a shockwave on it for the benefit of a strength
Mm.
enhancer. And then we'll do
Oh, I love
BFR
that.
with it. And it's absolutely
That's
fantastic.
cool.
Yeah. So we kind of stack
Oh
on
yeah.
top of it. So you're getting a lot of neurophysiologic input into it. And then you're getting all the growth factors you migrate them in there with the shockwave and then you
Yeah.
hold them there with the
Wow.
BFR. So the thing's just
Oh
getting
man.
like growth factors, all these
That's
muscle
amazing.
building. It's awesome. But so we do that a lot. And then there was one other point I was going to touch on with that. I'm trying to remember what it was. It's probably I'm losing it right now, but if
Oh
I
yeah.
come back to it, I'll
Definitely.
catch you with it.
What I love about Shockwave too, Keith, and I think you would attest to it, is that it doesn't take a lot of time. It's about 10, 15 minutes per
Mhm.
application, which is great for
Yeah,
time saving and for the massive effect that it produces and benefit to our clients. For that little time, what it can do is pretty powerful. The other part I wanted to mention is that, and this is where I want to pull on our good friend, Dr. Tom Padilla out in Arizona, where the way we frame this is like, listen, when you come in for something like Shockwave, let's just say you had a plantar fasciitis or maybe an IT band syndrome or golfer's elbow, the thought might be for your client to say that, well, you know, I'm coming in for the Shockwave and that's what's getting me better. But really, it's never the thing that gets people better. In fact, I would say Shockwave is, although very effective, is a small portion of a very comprehensive whole body, whole person approach. And I just want to make sure that clients out there understand that there is a what to your diagnosis, which is what we're treating. But what you and I and Tom and Natty and all of our guys, what we're trying to do is figure out what the root cause is to why you even had the tennis elbow, why you had the Achilles tendonitis in the first
Mhm.
place. But we need to make sure that patients know that there's a much bigger equation to what we're doing with just implementing the shockwave to our bigger plan of care.
yeah, yeah. Oh, you hit the nail on the head with that too. And so I think that's something that's really unique. I think as far as our profession or the environments that we operate in, and being able to deliver this world class technology. I mean, let's face it, this stuff is highly innovative. It's top of the class. It's got some really great research that's coming up off it. Leaders in the field. You got orthopedic surgeons and high end podiatrists that are working with Olympic athletes and professional athletes and whatever else. The Miami Heat just
Wow.
purchased a bunch of this stuff. Yeah, they just purchased ENAMTT and they got Shockwave and all that kind of stuff down through there. So there are a lot of professional sports teams that are adding this into their rehab as a result. But the getting back around to where we're going with it, I mean, the unique opportunity that we have as rehab professionals is yes, we have to heal this tissue. So if it's a plantar fasciitis and the Achilles tendinopathy, we have to heal the degenerative or the damaged tissue, and this is going to accelerate that significantly faster. We're talking 40 to 50
It's
percent
amazing.
faster.
Right.
Right. And so in some cases, not every case is that way, but a lot of cases, it's like boom, warp
Hmm.
speed, let's
Yeah.
go. Slingshot, engaged. Do you want to go tell any good night reference there? But the important thing is that there's still, while we can heal the tissue and regenerate it and get it back to normal function, if we don't ever take care and address of the root issue in the first place, the likelihood or the potential for that thing to come back eventually down the road is a very real thing. So even though we can get this tissue to heal and get you back to close to new again, um, if you don't correct the
Yeah.
mechanical thing or the neurophysiologic thing or whatever the stress is to that tissue, let's say it's a biomechanical alignment type issue, right? And it's an Achilles thing. So let's say it's actually probably coming from the hip or the SI joint or something like that, or it's coming from the foot, right? We can heal that Achilles, we get everything working properly again. But man, if you got really flat foot and you got a varus, a really bad varus in that thing, I mean, you think of a piece of tape or something like this, and this is your Achilles, and the bottom of your foot is doing
Yeah.
this all the time. Guess what? That inside part of that Achilles is going to get
Exactly.
stressed out again.
Yeah.
It's going to get inflamed. And then it's going to eventually come back at some point. So while it's an absolutely fantastic, and I think game changing tool, revolutionary, because there's so many people that we've had in our clinic where, you know, and I got
Yeah.
a pretty big toolbox, and I'm not
Yeah.
trying to pop an ego or anything like that, but I do have a lot of, as you get to be in the clinical field,
Yeah.
for over a decade. I mean, there's a lot of techniques, and you've had a lot of experience with different things. And so your toolbox continually grows as you're a clinician and therapist. And so I have done things where I've thrown absolutely everything at a patient before, and they're still kind of stuck, or maybe they're just a little bit
Yeah.
better, but not a whole lot. And then we do like shockwave therapy, and it's like, oh,
Crazy.
I don't have any pain anymore. It's like, and I just laugh. I laugh like a little, like a kid. I just get
Yeah.
going like, I'm
That's
just
so
kind of like, you
funny.
got to be kidding me. It just
Right.
unlocks the box and like, what in the world, but I could say confidently, there's probably been 80 plus. I'm probably on the
Yeah.
conservative side, 80 plus patients in the Siouxland area that we probably saved from a
It's amazing.
surgery that otherwise would have before shockwave, and like in the back of my head, I'm like, this is probably going to
Yeah.
be a surgical case. We'll do everything we
Right.
can to try to prevent it. We'll do the best job we can, but you kind of have that in the back of your head where like, this is bad enough to like, boy, I don't know. We'll throw everything we can to help you out to try to prevent this thing, but
Yeah, exactly.
you,
Right.
you know, but I mean, that thing is like the thing that unlocks the box. It's crazy. And like I said, I think it's so cool that we have this ability in our profession or in our clinic space to be able to provide this service. We're talking about last line of defense before any kind of surgical
Yes.
procedure would be done. Right.
It's
I
very
mean, that is
powerful.
pretty powerful. This stuff's more effective than injections and all that kind of stuff. Right. Now, let's not talk about like other orthobiologics such as PRP and all the other things. I think if
Oh
you
my
can
gosh.
combine those things
Yeah.
with this, it's even better. Yeah, and so Dr. Carsten Knobloch over in Germany, he presented in Boston at the Institute of Tissue
Wow.
Regeneration conference, and so this is some stuff that he was doing. Was actually he was injecting PRP, but while he was injecting PRP, he was
No, it
using
wasn't.
focused
Wow.
shockwave
Wow.
yes, he was, as it's coming out through the needle, and so he's stimulating all the
It's
platelets.
wild.
Right. And so like they're just getting
Wow.
super activated as they're on the way in to get into the joints. And then they were starting to note a pretty good
That's
effect
so
with that.
cool.
So but that's crazy. So yeah, for those that don't know, PRP stands for platelet rich protein. And so it's a orthobiologic that physicians will utilize to help stimulate, that basically draw blood, and
Yep.
they will spin it and basically inject it back in to stimulate a healing process or regenerative process
Yeah.
inside the body using your own,
Yeah.
using your own thing. So, but
Man, I
pretty cool
love
deal
that.
though.
I want to go to some case studies because speaking of surgeries and preventing or helping people not have to go through surgery, we had someone a couple of years ago where she arrived with calcific tendonitis. So she had, for anyone out there listening, basically calcium growing on her biceps tendon in her shoulder. It was quite painful. So she did a before X-ray and they found the deposits there. She came to us. We did, I think it was 6 sessions actually, Keith. And after 6 sessions, she wanted to go back. She was asked to go back to see the ortho. And he was like, "What are you doing?" And she's like, "Well, you sent me to PT." He's like, "Because your calcification is gone." And so I wish I had the x-rays, but I mean, clearly there was a before and after effect that was markedly different from what she came in with. And of course, like we said before, that was just the tip of the iceberg because what was it that caused her to get that calcific tendonitis in the first place? We had to address a lot of shoulder and thoracic biomechanics to be able to get all that better so that she wouldn't have to have this again. But the Shockwave was a great
Right.
helper in getting her past the symptoms of the pain so we could do things in rehab.
Mhm. Yeah. Yeah, no, absolutely. And we actually had a similar case, Jerry. And I know you talked to me about that one before, and we had
Yeah.
one this last fall. We had a patient, we had seen her
Ah.
before 2 years prior, and she had shoulder pain. And, it was like, wasn't really getting a whole lot better. And she ended up going to the orthopedic, ended up having a calcium deposit
Mm,
in the supraspinatus. And so I'm like, well, yeah, that's why I
no
wasn't
wonder.
getting better. And so they did a
Ah.
round of injections, to try to see if that would dissolve the calcium deposits. And I believe, the first two injections helped out fairly well for this individual. And then the third one, it
Mm,
really didn't do much, still having pain. And then so they ended up coming back to see us for therapy because this shoulder was bottom and now the other one was starting to bother them. And it was more of a
yeah.
tendinopathy on the other one. But so we were doing shockwave to both sides, and the side that had the calcific tendonitis, I mean, she was done in three
Amazing.
three visits, and she was
Yeah.
completely pain free. And so I'm like, it's like, gosh, I not that I want you to go back and get an X-ray from your doctor
I
right
would
now, but
love to
I'm
see that
really
too.
fascinated to see. I would like to see what this looks like, but at the end of the day, functionally, she's perfectly fine in that shoulder. She doesn't have any issues. She's still not having any issues, and it's amazing how
Yeah,
fast this stuff
absolutely.
can work. It
So
really
let's
is.
shift gears a little bit because this was a little bit entertaining for me to hear, but also seeing the efficacy. So, in my mind, if people out there are concerned about the way they look and about carrying fat in different areas, I can see why people will go this route. But I was surprised because you told me that this is actually has been shown to be effective in dealing with quote unquote cellulite and areas of your body where they're unwanted fat. And it is showing up in a lot of med spas.
Mhm.
My only concern with that was that, is this person really trained in their anatomy? Do they know what they're doing? Is my only concern. But if they are, I guess that's one other way of looking at it. But tell me about how Shockwave has now been used in aesthetics.
Yeah. So I mean, the use of acoustic pressure waves is kind of revolutionizing a bit of the aesthetics population there. It's the great thing
Hmm.
about it is it's non-invasive, right? And so there's no scarring, no downtime, no none of the stuff. And as we've seen in the orthopedic world of things, it does
Yeah.
fantastic for scars. It does fantastic for obviously regeneration of all tissues, but really what's it's really doing is a lot of
Mm,
collagen resynthesis, right? And so and that's where we're seeing it. So we can actually take away
crazy.
wrinkles in the face, or you can address cellulite in the legs or
Ah,
buttock area, or you can, lift the abdomen up, if you got that overhang a little bit, or if you had a
wow.
cesarean section, those individuals who had cesarean sections, we can work on the scar to help improve that and kind of
Mm,
remodel the tissue, tightening up a little bit through that area. Same thing with
yeah.
mastectomies. Individuals who may have had, a mastectomy
Mm,
from breast cancer. There's a lot of scarring
sure.
that can happen because of that, a lot of restrictions, and we can really help with those individuals and really kind of help from a
I love
cosmetic
that.
standpoint to improve their
Yeah.
quality of life with things. And so it's just fantastic. But with anything, you
Yeah.
have to put your work in with it as well. So like if we're going after you're treating it for fat reduction or body shaping or cellulite reduction and stuff like that, like while this is happening, we're reformulating and changing the cells, right? But you
Yeah.
still have to eat a proper
Yeah.
healthy diet, and exercise and stuff like that is important because you can't like expect to have this done and then
Right,
go
right.
like to McDonald's and Burger King and eat cheeseburgers and expect you not to
Yeah, hey, it's not
gain that
working. I don't know what's going
cellulite or
on,
fat
like,
pack,
what do you mean? I agree
Yeah,
with that. It's yeah.
yeah,
Go
yeah.
ahead.
So
Yeah,
no, I was
absolutely,
gonna
yeah.
say you got to take care of your
It's funny,
body.
I was thinking about how we can incorporate this into a definitely a wellness and weight loss program, and for sure, it's gotta include, obviously,
Mhm.
nutritional consideration, maybe functional medicine too, physical therapy if you've had some, limitations over time, and then using the shockwave to help with some of this reduction on the surface level will be really helpful for people on their path towards getting to where they want to look and feel the way they want to be.
Yep. Yep, absolutely. So, and I think that's a great thing, because
Yeah.
it's really about building confidence in who you are as an individual person or what it is that you're looking to achieve. Ultimately we're here to help guide you to your goals, whatever your goals are, what the outcome is you're looking for, then it's a nice pathway
For
to be able to
sure.
do so.
Keith, it's been awesome connecting with you and learning more about your past. I think we nailed some really good points about Shockwave that I really want our audience to tune into, which are it's safe and effective. It is non-invasive. It
Yep.
can help with a myriad of conditions from tendonitis to swelling to painful areas that are acute or chronic, to even
Mhm.
post-operative kinds of issues. And we can even help a
Yep.
lot of people in a fast amount of time because it's being used as part of a larger program. And finally, it can help make you look better. So there is no way. Yeah.
It can make you look better and it can help
Amazing.
you strengthen too.
Yeah.
So I just remember the last point that I was going to say earlier is from a recovery thing like we talked about, but it's absolutely fantastic to do. So one of the other things that we're starting to find too is there's a PT over in the UK that's doing he's getting his PhD in Paul Hansborough, and he's looking at performance in athletes and utilizing shockwave. And
Hmm.
so he presented in Boston again at that conference. And some of his early findings is 8%, or excuse me, 50% of the athletes that were testing quad strength on had an 8% improvement in strength 3 days after application,
Wow.
which
That's pretty wild.
that's massive. So
Massive. Yeah.
not only are we helping heal people and all the things that you had just discussed, but we're also helping improve their performance, their strength, and all these types of things. So, I mean, it's just a fantastic tool to be able to utilize to help people from acute to chronic pain conditions. Plantar fasciitis, Achilles tendonitis, it's absolute money for. But we see it
Yeah.
for so many other things. Hip pain, SI joint, lower back pain, any kind of pain, really, like neck, cervical stuff. A lot of times
Yeah.
people get a lot of pain up through here. They got a lot of trigger points. It's where they carry the stress. It's absolutely fantastic to help and release the tissues up through there. Golfer's elbow, tennis elbow, shoulder pain, rotator
Carpal
cuff
tunnel syndrome
issues,
too, right?
carpal tunnel syndrome.
Yeah.
Yes, carpal tunnel
Yeah.
syndrome, Decker veins, tenosynovitis, which is the
Yeah.
tendonitis in your wrist here.
Mhm.
It's absolutely fantastic for any kind of muscle tendon problem.
I love that. Keith, thank you so much for sharing your
Yeah.
expertise. And how can people listening to our show get in touch with you if they are in the Akron or Sioux City area of
Yes.
Iowa? Yes.
Yes. Saliva. Yes. So they can get in contact with us. They can go to our website at www.impactptwellness.com,
Hmm.
or, certainly they can give us a call, 712-560-0460. You can also look us up, Impact PT Wellness, on Facebook or Instagram. We do have things there as well too. And you can direct message us via those routes.
Sweet. All right. So, question for Dr. Rode. If you won the lottery, but in order to collect, you had to continue to work a full time job, what would that job be? And it cannot be the job you currently do.
Ooh, that's a good one. Boy, and it can't be related to the field.
No. Oh.
Okay. All right. All right. So I would say, um, go
Oh,
truck.
yeah.
I do like tacos,
All the
but
tacos too. Yeah.
I like doing lawn work.
Get out of
And
here.
so yeah, something like that would be fun,
Wow.
or engineering.
Oh,
I think that would be kind of fun also too.
there you go.
How about
That's
you?
cool. Me. Oh, I would,
Yeah, back on you. Turn
oh
it
my
back
goodness.
around.
There's so many things I want to do, Keith. I would actually love to own a food truck. And I actually thought about this. So I love Polish food and I love Korean food. And I thought with a good friend of mine who's Polish, if we had a food truck called Kimchi and Kobalsi, because the foods pair so friggin' well. It's crazy. But that's my dream far, far away.
I've had this discussion with a buddy too.
Yeah.
Ragbri is a big bike race across Iowa that's happening
Ah.
in July.
Yeah.
And we've teased with the idea of, following along and going on these stops and bringing like the Normatex units and everything
Oh,
along with us.
yes.
And we
Yes.
have a food truck. We call it
Yes.
tacos and
Oh my,
tune-ups.
I like that. Dude, I looked at it and laughed. So I thought, I'm glad you said that because we wanted to do something where we do, you come to the food truck, but you have a workout of the day that's there. You got to do the
Uh-huh.
workout and you get a discount on your meal for that day. But
Yeah, yeah,
yeah,
yeah.
cool. I love it.
Get into it up, you get fast sausage tacos.
Keith, there's something to this, man. We got to get on this somehow one day.
Yeah, 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 yeah.
Cool. Keith, thanks so much for joining us again. And for our listeners
Yes.
out there, thank you so much for tuning in. We hope you'll like, share this episode with any friends who are interested in Shockwave. Take care.
Yeah, appreciate it. Thanks.
Thanks so much for tuning into today's episode. It really does mean a lot to us. And don't forget to like, share, subscribe, or comment if you got at least one or two helpful insights or takeaways to help you get to your next level.